A community health fair returned to Preston at the weekend, where locals were invited to undertake free health checks, including those for diabetes. Guests from around the UK gave speeches and one-to-one support to members of the local community, including advice on how to improve your lifestyle. Henna Sony went along to get checked out.
A major health event in Preston, attracting thousands of people each year, was back over the weekend. The Health Mela has been providing free health and wellbeing support to the local community for the past 15 years.
Well, we started with the Southeast Asian population, and we found that certain illnesses such as strokes, hypertension, renal failure, diabetes were very high prevalence on those, and yet the uptake from the hospital and the advice in their lifestyle was very poor. So we thought that education was important, and we started with monthly lectures in the GHS, and then we started annual Health Mela, where all the population, including ethnic minorities, can take the benefit.
This year's key health topic was diabetes. The chair of Diabetes UK, along with local health professionals, attended the event and gave information and advice.
It's something like 1 in every 16 people in Lancashire and in the rest of the country will have diabetes. Now, most of those will have type 2 diabetes. About 10% will have type 1 diabetes, which is entirely a genetic condition. Those with type 2 diabetes, we don't really know what causes it, but we do know that your lifestyle influences how likely you are to get it. But in both cases, you're absolutely right. People have to look after themselves, and diabetes is the biggest single reason for people going blind in working age, which is nasty. And there are something like 3 times as many people with diabetes as there are with cancer.
One of the most important ways to treat diabetes is early diagnosis.
If you diagnose early, you can start treatment early. And there are a lot of studies have shown that if you start treatment early, you prevent complications in the long run. Now, the biggest problem with the NHS is that we are spending most of our money in treating complications, 80%, roughly about 8 to 10 billion we spend in treating complications. But if we diagnose early, we treat them more early, then we can prevent complications, we can save that money. So that's why this is very important.
A vital aim for the team was to diagnose people who wouldn't normally see a GP. This was the case for Shane.
I've got diabetes in my family. I know what some of the precursors, and I've just started seeing them. I've not been able to get into my doctors because I've been so busy, but I knew this was coming up, so I popped in and talked to the team, and they've been very, very helpful. Well, it's going to be a complete lifestyle change, really. So the sugar's pretty much is gone now, basically out of my diet, pretty much. And when I've talked to the team next week, I'll find out what else I need to do.
But it's not just the public who are open to knowledge. UCLAN's partnership with the Health Mela enabled students to get a first-hand experience dealing with patients.
Great for us to get involved because it means that our medical students and our nursing students can take part. It's our second biggest community event. Everybody gives their time freely, which is staff and students. It's a great example of how we're working with the city.
Other organisations have seen the Mela develop from year to year and shared the successful growth that started off as a community seminar.
Well, the success to the whole thing is that we've had 10 years of steady growth at the Gujarat Centre, and we got the whole community to come and also have the health checked, which is all about prevention and also early diagnosis of any illness you may have.
And Prestonians should be proud that they've given that a sort of blueprint to the nation. We have held these health melas in Yorkshire, London, Greater Manchester, and we are going to Cumbria now. So I think this is a model which is the unique of engaging communities, empowering them to take the charge of their own health.
Henna Sony, that's Lancashire in Preston.